Hi everyone, my name is Rob Castellanos and I'm the founder and CEO of Syndio Health. We're happy to have Julie Ryan here on the call with us. We're starting a video web series where we have conversations with people who've been influential in the fibromyalgia space. So let's go ahead and get started. Julie, why don't you tell us about Counting My Spoons, chronic illness bloggers, and how you got into starting to do things with fibromyalgia online.
So in 2010, I was diagnosed with fibromyalgia, and I actually started counting my spoons shortly before I was officially diagnosed, just because I knew that that was the direction it was going. At the time, it was more kind of about my journey and what I was experiencing.
And this was before a diagnosis, or this was after a diagnosis?
Both. For probably the first couple of years that I blogged, it was really just about my experience and what I was going through, the medications that I tried, supplements, all of those things. But then kind of as my journey progressed, the blog progressed with it, so that, as I started feeling better, and I was able to share the things that helped me feel better, it became a lot less about me and a lot more about fibromyalgia and the other illnesses that I deal with, and kind of how people can cope with those things. So both from a treatment perspective, as well as from kind of more of an inspirational, living positively despite our chronic illnesses perspective. So I shared medical studies, and then also stories from other fibro warriors. And then a couple of years ago, I started Chronic Illness Bloggers, which is basically just a network of bloggers with chronic illness. I think there are like 700 bloggers now. But my goal there was to help connect those bloggers with companies and sponsors that have products and services that help serve the community, so that we can kind of help get the word about those products out, but also to help those bloggers make a little bit of income off of what they're doing. And then earlier this year, I actually sold that to Jenna Farmer. So she's kind of taken that on, and I've moved over here now to help you guys.
And we appreciate it. It's been a very big help. So at the end of the day, the common thread is that it's very difficult for people to go from symptoms to diagnosis, and then after that, it's about finding treatment that's going to work for you, because it does vary for everyone. So when you've been taking the blog, what have you seen as the biggest things that have helped you in finding the treatments that are actually going to help you, and what you've kind of gotten from your community as you've shared those experiences?
Finding treatments for me has been very much trial and error. It's been digging, and I come across something that somebody mentions in another blog, or an article somewhere that might be helpful, and I end up trying it. Less so now, because I'm kind of in a place where I'm doing pretty well. But there are some treatments, and the ones that actually helped me the most were ones that I heard about and read about literally from the time I was diagnosed, for the couple of years before I tried them, and I just resisted because it was kind of too hard, and basically that came down to changing my diet and lifestyle. But those were the things that actually helped me the most. As far as the community goes, it's been kind of the same. I mean, there's people who are definitely just looking for that magic pill. They want something they can take that's going to make them feel better. And then there are those who are willing to basically try anything. And I think a lot of that depends on where they are in their journey. So the reception varies a lot.
Yeah. And it's difficult because every treatment you try has its risks and its benefits. And some are more severe than the others, depending on if it's medication or lifestyle. But it's also, especially with lifestyle changes, it completely flips the way that you go about a normal day. And sometimes it doesn't work, so it can be hard to commit to. So what exactly are the treatments? Because I know you've mentioned you've tried over 50. What are the treatments that really have made a difference for you in the past few years to really be at a point of managing your fibromyalgia and living and doing normal things at the same time?
Like I said, the biggest things that have made a difference for me are diet and lifestyle changes. So for me, that was stopping eating gluten completely. I also have, really limited carbs a lot, so I don't eat a lot of grains in general. I try not to eat a lot of processed foods. So I really try to stick more to a whole foods type diet. I'd probably do that on maybe an 80-20 type perspective, so that there's still about 20% of the time that I'm eating more processed foods or going out to eat, things like that. But even when I'm doing that, I stay gluten free because I found that that's been the biggest contributor to pain for me.
And doing some is better than being perfect. So at the end of the day,
I mean, that's what it comes down to. Do what you can, because you can't be perfect at anything.
So it's almost a bit of a Walls protocol. Famous researcher with multiple sclerosis, where it's really going back to a somewhat paleo diet, but much, similar to how cavemen used to eat, of fresh meats, vegetables, fruit, that kind of stuff.
Yeah, just being much more mindful of what you're eating makes a big difference.
Yep. So we met, I think it was about 5 months ago, and it started out with me reaching out to just have an initial discussion with you. Why don't you tell us about kind of how we got involved working together, how that started off at the beginning and where it's come to now.
First off, sorry about the noise. There's a kitten going crazy next to me.
It's all good. I wish I had one here.
In a minute. But yeah, you reached out to me, I think around the first of the year, initially just to have a conversation about what you were doing with Syndio Health. And, through those initial conversations, we ended up, basically forming, I guess, a little bit of a partnership. And you asked me to come on board and write for you, which, I greatly appreciated, because income is awesome. Any income is awesome when you have chronic illness. But, what's been really awesome for me is, that it's turned into not just another freelance job, because, I do a lot of those, but definitely become something where I feel like I'm, a part of this thing that you've created and part of a team. And, the entire team and everybody that at Syndio just has a very great outlook, very positive. And so it's been just really nice to be involved there. Obviously we've become friends as we've gone through this, I feel like, and, have been able to expand from just me writing, the treatment info to staying on board and hoping to help develop future illness treatment information.
Yeah. And just to make a slight correction, it's not something that I built, specifically because I cannot even code. But it's something that we all did, and honestly, we would not have been able to do it if we didn't have you writing content, because anybody that knows me knows that I'm not concise, and there's no way I could have done it the way you did. And the rest, which I'm trying to work on, which I think I've done okay on this call at least. And the rest of our team is really the ones that put together a platform that has no distractions. It's the information that you want. It shows you the relevant treatment information and then people's reviews. And we wouldn't be where we are today with something out there if it wasn't for you coming on board. So, on our end, it's a very appreciated partnership and friendship, and one that we definitely look forward to continuing. So, kind of going on that vein, this is really where we're starting with Syndio in terms of making it easier to find treatments that work by seeing what works for others. But there's a lot that we can really do in the next several years. And I want to get your opinion on, what do you see as kind of a vision over the next 5 to 10 years of things that you would like to see changing in the fibromyalgia community that you think are important and would really make a difference in people actually managing the condition?
That's a big question. I think that we've seen a lot of growth, in the time that I've been, dealing with fibromyalgia. I know when I, was first diagnosed, there really wasn't much of any information out there. There weren't even the blogs that are available now. But we've seen so many more people who have jumped on board as they've been diagnosed and actually taken an active role in raising awareness and advocating for the community. So, whether it's blogging or sharing on social media or, whatever they're choosing to do to share what's working for them, not just what's working for them, but all the various information that's out there. And I think that continuing to see that grow over time is going to be really important. And encouraging others to take part in that, to not just sit back and wait for answers, but to push for them and to seek them out. I think getting patients to understand that the doctors don't have the answers and that they can't just wait for them to hand them a pill is going to be huge for us. And I think, helping patients to see that there are other options out there other than, Lyrica and Cymbalta, and I think Savella is the third, approved medication. That, while maybe some of those options might be more expensive because they're not covered by insurance, that they might be better options for them, even though they take a little bit of work.
Yep. And at the end of the day, I mean, the position that we're trying to take here is everybody's limited in terms of what they can see related to information of what they can do, right? You're limited by the doctors in your geographic space. Maybe there is a doctor that actually does know the treatments that are going to be most effective for you. But on the internet, there's also just a lot of information, and it's very hard to sift through it. So I think that part of the value that you really added in coming on board is that Lyrica and all of those medications, for some people they do work, and then for other people they have very bad effects, and it's really not the right treatment. But if you can start to see in a simple manner the more lifestyle oriented treatments that actually do make a big difference and are less risky, people can start to learn, okay, I should combine that with a medication that has worked for me, or they can start to go more into the holistic route if they do find that it actually is helpful. So in terms of moving forward with other conditions that people have with fibromyalgia, have you seen a lot of overlap between what you've been doing to treat fibromyalgia and it helping you with other conditions, and vice versa? Or what's been the relationship that you see there?
There's definitely some overlap with some of the treatments. In addition to fibromyalgia, I deal with chronic migraines as well as endometriosis and irritable bowel syndrome. And I definitely noticed that when one of those starts to flare up, they kind of all come with it.
Yeah.
So, one thing gets aggravated, everything gets aggravated. But at the same time, the treatments that help, whether it's diet or, wearing the Theraspex glasses that I normally wear for migraines, those things help kind of everything. So, the light sensitivity that I deal with migraines also impacts fibromyalgia, because with fibromyalgia, we're overly sensitive to kind of everything, whether it's light or sound or touch. So being able to diminish, that issue for migraine definitely helps. I take CBD oil, which has been amazing for helping me sleep, but it also seems to have greatly reduced my migraines and improved, irritable bowel syndrome. Diet, not only has massively helped fibromyalgia, but it has definitely improved irritable bowel syndrome symptoms as well as, decreased migraines. So they definitely are all interwoven. And I think, long term, the ability to see those effects across the board and to also see the combined effects of different treatments, because nobody's doing just one treatment, or at least very few people are doing just one thing. So, I think it's really important to be able to see those cross treatment issues, whether it's increased side effects because we're combining treatments, or just increased value of those treatments when they're combined.
Yep. And, at the end of the day, to reference one of the things you mentioned earlier, of you can't just wait to get a magic pill from a doctor. At the end of the day, your body is a very complex system. And when you have multiple conditions, every little thing that you do is going to affect the rest of how you're feeling. And so it really is about that trial and error and starting to see, okay, this helps me with these symptoms, and when I combine it with this, it's actually helpful, or it takes away the effect of me feeling less pain. And so, with most people needing multiple treatments to actually find something that works, that's part of what in the next few months we look forward to starting to explore, which is being able to help people do that trial and error process of trying no caffeine, consistent sleep, and a medication for a month, and seeing how they're feeling towards the end of it. So, Julie, we appreciate you taking time to chat. This has been a very helpful conversation, and we definitely look forward to more. Do you have any final thoughts on really, in using Syndio Health, some of the things that you found beneficial and where you see that going in the partnership with Counting My Spoons?
I really like what is going on with Syndio, and that's the biggest reason that I jumped on board. The first conversation that you and I had is I asked, what's different from, with Syndio versus other options for treatment reviews that are out there. And, your biggest answer was A, simplicity, and B, that we're not tied to basically pharmaceuticals. We're not, being sponsored by any of the treatments. So it's 100%, I can't think of the word, but disconnected. Right. Yeah. And, I think that's really important to understand, just because a lot of people don't realize that, a lot of times you look at different websites and the information that you see is adjusted because of a sponsor that's attached to it.
Yep.
And so by having something that's completely free, like what we're doing, and the ability to just, go through and see an aggregate view of specific treatments, to say that, it's not just reading what, my experience was off my blog and then having to go to somebody else's blog and try to figure it out yourself. Like, okay, this person had a great experience, but this person had a crappy experience, and this person over here had this experience, and you're trying to put it all together in your head that is already muddled by fibromyalgia brain. But we've taken all of that and put it together in one much simpler. So, I think that's the biggest thing I've come away with on Syndio, and the ability, the questions thing is also really awesome, that there's a way to, if you've got a question about a treatment, you can just ask it and somebody will pop in and be able to answer and share their experience to, with whatever it is that you're dealing with.
Yep. And much of that credit goes to you, to be completely honest. So, Julie, thank you for taking the time. To any people that have been watching, if you have any questions or comments, please feel free to post them in the comments section or message us directly on the page, whether it's Counting My Spoons or Syndio. So, Julie, thank you so much, and hope you have a good day good rest of the day with your cat. And yeah, we look forward to do another video blog next week. Thank you, everyone. Bye.
Thanks, Rob.